What causes acne? Find information on the best ways to treat acne vulgaris and improve your health. Acne vulgaris is the world's most common skin disease. Anyone of any age can get it, but teens and young adults are most likely to suffer acne outbreaks. In fact, 80% of people ages 11-30 had acne outbreaks at least occasionally. To understand acne, you have to start with human hair. Hair shafts cover the human body and are everywhere except the palms of the hands and the soles of the feet. Some hair is visible, and some is very fine and nearly invisible. Each follicle is embedded in the skin with an oil gland called a sebaceous gland. Acne starts at puberty. Oil glands are small in children, but puberty, and testosterone in particular, causes these glands to grow larger. They secrete oil and cellular debris in a substance called sebum. Sebum keeps the skin flexible and acts as a protective barrier against water evaporation on the skin's surface. It also keeps hair shiny and soft. Acne and clogged pores. Sometimes skin cells clog off these follicles, also known as pores. With the pores clogged, sebum gets trapped inside. Skin bacteria called Propionibacterium acnes, P. acnes, starts to grow inside the pores too. The bacteria cause inflammation. When the clogged pore bursts open, all the sebum and P. acnes bacteria spill onto the surface of the skin, causing breakouts. Comedones, blackheads and whiteheads. Comedones are clogged pores that fill with sebum, oil and cellular debris. Comedones can be either blackheads or whiteheads depending on how deep they are in the pores and how long they've been exposed to air. Comedones are the first step toward pimples. The word comedo was coined in the late 1800s. It is based on a similar word for parasitic worms, which apparently bear some resemblance to the comedo within a clogged pore. Products can cause blackheads and whiteheads. Products that may trigger comedones are called comedogenic. Makeup labeled non-comedogenic is less likely to clog pores and contribute to acne. What are blackheads? Blackheads appear on the skin as tiny black dots. The dark color of blackheads is not caused by dirt. Instead, this is the color sebum takes after being exposed to air. Blackheads also stretch the opening of a pore. Blackheads are sometimes called open comedones. What are whiteheads? Nose, chin, face. Whiteheads are small, raised bumps on the surface of the skin, and they are another form of clogged pore, comedo, that can be a precursor to pimples. Similar to blackheads, whiteheads form when the hair follicle fills with sebum. Unlike blackheads, whiteheads haven't pushed all the way through to the skin's surface, so they are considered closed off from air. That turns the sebum dark or black. Whiteheads are sometimes called closed comedones. They often appear on the face, especially the chin and nose. Papules, pimples. A papule is a tiny pimple, less than 0.5 centimeters wide. It usually has a dome shape. Papules are sometimes called pinheads. Papules do not contain pus. A large number of papules may indicate moderate to severe acne. Don't pop your pimple. This type of pimple may be sensitive to the touch. Picking or squeezing can make the inflammation worse and may lead to scarring. Papular acne. One form of acne is called papular acne. That's acne that has more papules than pustules. More on pustules in the next slide. Papular acne is common in people with coarse, oily skin. Pustules, pimples. Pustules are another kind of inflamed pimple. They resemble a whitehead with a red ring around the bump. The bump is typically filled with white or yellow pus. How are pustules formed? Pustules are inflamed pores filled with the P. acnes bacteria. These lesions are what people typically think of when they think of pimples. The bacteria attracts the body's natural infection-fighting cells, which cause the irritation and redness associated with pimples. Pustules eventually burst open, releasing all of the oily sebum and bacteria. When they do burst, the bacterial substance causes more inflammation. Pustules can form anywhere, but they are most common on the face, back, shoulders, breastbone area, and sweaty areas like the armpit and groin. Don't pop your pustule. Avoid picking or squeezing pustules. Picking can cause scars or dark spots to develop on the skin. Nodules. The bigger, deeper papules. Nodules are forms of papules, but they are bigger, and they form more deeply in the skin. These are large, inflamed bumps that feel firm to the touch. Nodules develop deep within the skin and are often painful. Nodules should be treated by a dermatologist. Over-the-counter treatments may not be powerful enough to clear them up, but prescription drugs can be effective. Cysts. Making a diagnosis like nodules, cysts are a more extreme lesion that can result from acne. Also, like nodules, cysts can be very painful and should be treated by a dermatologist. Acne cysts are closed pockets of tissue filled with pus. They resemble boils. Surgeons can drain or remove cysts. People with nodules and cysts are usually considered to have more extreme forms of acne. These lesions are more common in men than in women. Cystic acne requires special treatment and will be discussed later in this article. Skin blemish types. Mild acne. Acne falls into the mild category if you have fewer than 20 whiteheads or blackheads, fewer than 15 inflamed bumps, or fewer than 30 total lesions. Mild acne is usually treated with over-the-counter topical medicine or self-care. It may take up to 8 weeks to see a significant improvement. Self-care for mild acne. While more severe cases of acne may require either topical or systemic medicine, mild acne symptoms can often be improved by practicing good daily self-care. Here are some tips to ease your symptoms of mild acne. Gently wash your skin twice a day on the spot of the acne. Use a soap that is mild, and always use a clean washcloth. Work the soap in gently for a minute or two, and do not scrub. Rinse well. Anytime you work up a sweat, wash right after. Sometimes oils from hair can exacerbate acne, so wash your hair at least every other day. For men who shave, wrap a hot towel around your face before shaving to soften the hair, and always shave along your beard's natural grain. Leave the acne alone. Don't pop it, don't squeeze it, don't scratch it or poke it. Doing so can cause scars and infections. Avoid the sun and sun lamps, especially if you're on antibiotics for acne. Choose makeup that is water-based and oil-free. Avoid oil-based creams and lotions too.